the mental status.
Yeah, that's what I was guessing.
Apparently they're standard tests, huh?
Right, we give them to all of our patients as well.
Yeah. He asked her to
Count backwards?
count in tables of sevens backwards, starting from 70, I think.
Yeah.
Something like that.
Is that typical?
Yeah,
Yep.
that's on the exam.
That is hard. I have a hard time doing that. My friends and I always joke that if we had to take that test, I don't know if we'd do very well.
But they ask you what floor you're on and what kind of building you're in?
Not exactly. He did ask me what month it was, what day of the week it was. He pointed to his tie. What's this?
Good.
Well, my friend Roy Morris, who was director of research at Winston-Salem RJ Reynolds, his wife has Alzheimer's. And the test that she was given, she couldn't tell the day of the week.
Right. Alzheimer's is very different from this.
Yeah.
How is it different?
Well, it's a progressive disease. It'll get worse. It affects more of a global cognitive ability, whereas this seems to be confined to forming new memories, but judgment isn't impaired in Grandma's case, whereas judgment in sort of how inhibited one is affected with Alzheimer's. So you don't know what is appropriate and what is inappropriate topics of conversation in Alzheimer's disease.
Jeremy, have you any intimation of how well you handled this final exam that you were
Oh,
doing?
no. I won't find out for another couple of weeks.
Yeah,
but he means, was it hard?
Oh, gosh. It was hard. Definitely, no doubt about that. It would say 8 hours of testing.
Well, it was hard from the standpoint of laborious.
Yeah, the questions are difficult too.
Oh, I see.
It's every single question is a paragraph or two that you have to read. It's just a case description of someone coming into the emergency room or into the doctor's office.
You have to make a judgment or
they either ask
analysis?
what's the diagnosis, what's the next thing you would do to get to the diagnosis, what treatment would you provide. And
that's pretty detailed.
It's very subtle because they'll ask someone who has an infection, what kind of antibiotic would you give? So you have to be able to figure out from the story they give you, does this person have a virus? Is it bacterial? And if it's bacteria, what kind of bacteria? Would it be likely to be given the person's age and their symptoms and their location in the country and are they in a hospital? Are they at home, etc.
Yeah.
So it's a lot of nitpicky stuff. And often, they'll give you a list of 10 different medicines to choose from. And, maybe 2 or 3 of them would definitely not be the thing. But then, the rest, they're all fairly comparable. And you have to think about side effects and which are more appropriate for this person's race and which, for this person's age and that sort of thing.
And this is the one given nationally, or?
Every person before they go into residency has to take it. So.
Given by whom?
It's run by the United States Medical Licensing Examination Board.
Yeah.
And they make it. It was a lot of questions. It was sort of like seeing 400 different patients in one day.
That's a good analogy.
It's 400 questions, and each one is a new patient. So you have to analyze and diagnose them. You have about a minute per question.
Oh, you're kidding?
Yeah.
Oh, my.
A little more than a minute, because they give you 50 questions in 60 minutes. So.
Jeez. So you really have to know.
Be confident.
And not muddle around.
No time for muddling. You have to.
Yeah.
Yeah.
And Jeremy said that when he got out to his car after this grueling day, His friends had tied a whole bouquet of balloons to the car.
Yeah, and they decorated it with, you know, a big congratulations sign.
It's
And
over.
Oh,
I was so happy, I couldn't believe it.
That's
really?
very sweet.
Yeah. Now, your whole graduating class took this exam?
Yeah, we don't take it all on one day.
Oh,
It used to be that way, but now it's on computer. And so there's a bank of about maybe 15 computers, so we each sign up for a different day
Oh.
and go and take it there.
Well, they have different exams. Then,
Exactly. There's, you know, it's totally random which questions you get.
Yeah,
But they're all similar in their difficulty.
yes.
So,
Then do they grade you, or is it pass or flunk?
it's pass fail. So, I mean, there is a grade, but it doesn't really matter.
Yeah.
It's not because everyone's done applying to anything. So pretty much all you have to do is pass, and then you're set.
Yeah.
I don't know.
Now, do they have special honors and awards at your commencement?
Mm-hmm. Yep. They always have awards for one
Yeah.
thing or the other. So, I don't know if I'm getting one. We'll find out, I suppose.
We'll hear about it.
Yeah.
Well, we were so pleased at the commencement that we attended when they honored you so highly.
Yeah. Yeah.
He's an honorable man.
Mhm.
He's really put a lot into getting this medical school degree.
Yeah. I'm glad it's almost over.
Yes,
2 weeks from now, we'll be calling him Dr. Hurst.
that's wonderful. Yeah, it's a lot of sweat and tears, isn't it?
Yep.
Which of the 4 years was the most challenging?
Either first year or second year. Yeah. Sitting in lecture for hours and hours a day and studying all the time is much harder than working in the hospital.
Oh, I imagine so. That's touchy-feely thing.
Right. I mean, even though the hours I put in were longer in the hospital, it was much more enjoyable and more interesting.
More stimulating. I
Yeah.
Whenever you people feel like it, Mother and I walk once around the block.
That sounds good.
That would be great.
Yeah, we're up for that.
Yeah, why
Good.
don't we, Mother?
All right.
We're
I'd like
gonna
the
take
fresh
a
air.
walk around the block.
Yes, with
Okay.
me?
You with a cane?
With me. All
Yeah,
right.
with you, of course, and the cane.
Yes, Terry and Sarah are friendly.
Yeah, apparently through that temple, I guess.
Which way, left or right?
Oh, we'll go right. Don't face into the sun. Thank you. And, yeah, I'm glad you're here. That's all right. Reloaded.
Uh-huh.
It's been going on for a couple months now.
Well,
And they're air conditioning the whole house. The son, the oldest, graduated University of Indiana. We're being photographed.
Yep.
Look at these beautiful flowers in this tree here. It's near the,
oh, that's a dogwood.
yeah,
The Virginia's tree.
shedding now. Yeah, isn't it a Virginia tree? I didn't.
Well, it's the state tree in Virginia.
Yeah.
Does Mrs. Peckham still live here?
Yes,